Well, good morning, and thank you all very much for coming. We have ahead of us, I think, a day that's going to be extremely interesting, in many ways highly technical, but very important as that merges into, as I will note, what we hope will be some later on panel discussions on policy and where we go from here. My name's Tim Wirth. I'm the former president of and currently vice chairman of the United Nations Foundation. We have been working on this issue through one of our programs, which is the Energy Future Coalition. That is a coalition of people that were put together right after 9/11 by John Podesta, Boyden Gray, and me to look at the energy issues and as a root of what had transpired at 9/11, and that there were a series of energy questions that had to be addressed. And then we found our way into fuels, and part of that discussion was the discussion, or the beginning of a discussion and an exploration of aromatics, which has been driven in great part by Boyden Gray, and you'll be hearing from Boyden this morning. I want to pay a special thanks to the National Institute of Environmental Health Sciences. Thank you very, very much, Dr. Birnbaum. We met each other at a Heinz Center discussion a couple of years ago, and she has been very cooperative and wonderful in the collaboration on this important subject. And we want to thank the Institute of Medicine. My old pal Harvey Feinberg is president of the Institute, and I called Harvey, and he agreed to let us use the auditorium to be here at the National Academy building. And also to Paul Billings and the American Lung Association, the American Council on Renewable Energy, and the Environmental Study Institute, all of whom have been sponsors and supporters of this effort. This is a conference being presented to an audience, many of whom are not scientists. So it's vital that the presenters and expert questioners try to explain the science in layman's terms to the extent possible. We've divided the day-long inquiry into two basic subjects. This morning we're going to ask, what do we know about the origins of fine and ultrafine particulates in the environment, especially those that are man-made, such as those which come from vehicle motor exhaust, the degree which these substances change in the air after they're created, and the range over which they are transported and remain concentrated enough to present potential health risks. The data on this seems to be coming in now at quite a remarkable and somewhat alarming rate, and as our timing for having this discussion, it seems to me to be just about perfect. Second question for the afternoon is, what do we know about the human health risks of these ultrafine particles and the chemicals that they are associated with once they are inhaled or otherwise ingested? We've recruited expert presenters to form a panel that will lead us in addressing each of these questions. We've done what we could to recruit outstanding scientists active in this field to present their work, and we're very grateful to them for being willing to do so. Of course, not everyone could change their schedule to participate with us today. However, we intend that this conference be, as much as possible, highly participatory, and we know that there are other outstanding scientists and specialists in the room. Therefore, we've built into the program a good deal of time for questions, answers, and discussion. And in order to save time and make the non-scientists among us comfortable asking questions of the scientists on the panel, we'll pass out index cards during the panels, Ronald Reagan's 3x5 cards, for people to write out questions that will be passed on to the moderators. This doesn't mean, however, that the audience members who want to report on their own work, make a brief comment, or ask a particular question of a particular panelist shouldn't just raise their hands and be recognized for that purpose. And I hope people can stay in as close as possible, as we have a larger room than we have people here, and so being close and more cozy would be better. Indeed, the extra time that we've planned to include the opportunity for other research scientists who've done their own work on these topics to stand up, summarize in a couple of minutes their own research, their conclusions, and why they believe that their research adds to our understanding of our two basic questions for the day. We'll also be webcasting this conference during the day to many others unable to be here in person, and they will have the ability to send in their own questions, commitments, and comments which we'll pass on to panel members. A few notes on administration. We're not planning to interrupt the morning for a coffee break. The coffee and continental breakfast will remain available until mid-morning, so please get up and help yourself while the conference continues. You'll have a chance during the lunch period to reconnect with the outside world, so please silence your cell phone while in the auditorium. Lunches will be served as a box lunch out in the same area where the breakfast was served. Restrooms are out that way as you go out here and go back out in that direction. Finally, as follow-up plans, we're recording the conference and plan to make the recording available on the Energy Future Coalition website. Our current plan is to follow this conference with a second event on the policy implications of what we discussed and learned today. While still tentative, our current plan is to host that policy conference on the 20th of May at the UN Foundation's new headquarters at 1750 Pennsylvania Avenue. And we will, of course, notify everyone who is attending and who was invited to come to that session as those plans sort out. So that's enough as boilerplate and background and explication, and I hope that makes sense. And if there are any questions, please wave your hand and let me know, and I will try to answer them. Good. Sir, please.
Are there going to be bathroom breaks, or is this just...
I think it's fluidity. You'll just move in and out, I say. Okay, let me start by introducing the opening session for us this morning. Dr. Linda Birnbaum, whom I introduced briefly before, has served as director of the National Institute of Environmental Health Science, NIEHS, part of the National Institute of Health, and for the National Technology Program since January of 2009. She oversees federal funding for biomedical research to discover how the environment influences human health and disease. I would introduce Linda now, and then I will go on and introduce Paul Billings and Lynn Goldman, and finally Boyden Grace. So Linda, you're on.
Well, good morning, everyone. It's really an honor and a privilege to welcome you all to this workshop, which is hosted by the Institute of Medicine's Roundtable on Environmental and Public Health in partnership with the Energy Future Coalition. The meeting really is the result of my initial interactions with Tim on the need to assess the current state of research on understanding potential health effects of ultrafine aromatic particulates in the ambient air with the focus on vehicular emissions. As most of you in the audience are aware, that the first Harvard six-city epidemiology study, which was funded by NIEHS, has had significant influence in reassessing the NAAQS for PM. Our continued support for this study, along with EPA, led to the identification of robust associations between PM 2.5 and cardiopulmonary mortality. The NIEHS investment in the past 2 decades has added an understanding biological plausibility for the health effects observed in the epidemiological studies that initially started with respiratory effects and understanding the addition of the cardiovascular impact as well as the impacts on the nervous system and on birth effects. So emissions from motor vehicles are a major source of ambient ultrafine particles. Central monitoring of ultrafine particulate concentrations in ambient air, however, is generally lacking. In fact, it's really only within maybe even less than the last 10 years that we have monitoring of the fine particles, the 2.5 micron. Before that, all the monitoring was of the larger particles or the totality of at PM10. So new emission control technologies which have been introduced over the past 20 years have contributed to modified composition of emissions with increased release of ultrafines, increase in nitric oxides, and increased levels of nitro-PAHs. The NIEHS research portfolio in air pollution and focusing on cardiopulmonary health is supporting research to identify acute and chronic responses in diverse animal models and cell culture systems, and trying to gain fundamental understanding of health effects and translate the knowledge to several ongoing epidemiological studies across the U.S. that can monitor biomarkers of exposure and of response in disease, etiology, and exacerbations due to air pollution. And you're going to hear from a couple of our grantees this afternoon about the health effects of particulate pollution. So to address the key scientific issues starting from exposure assessment to potential health effects from ultrafines, with special emphasis on emissions from vehicles, this workshop has assembled a panel of leaders in the respective areas of research to present what is the current state of the knowledge on the potential health effects of ultrafines with aromatics, and what research strategies are needed to address this emerging environmental public health issue. I'm looking forward to really an exciting interactive session with leaders in the field. Thank you.
Well, thank you very much, Linda. Our second opening presenter is Paul Billings from the American Lung Association. Paul is Senior Vice President for Advocacy and Education for the probably this most important public health group in the country. He is standing in today for President Harold Wimmer, who could not be with us. We've met with President Wimmer and with Paul about all of this in the months in the past. The American Lung Association, as you know, is the leading organization working to save lives by improving lung health and preventing lung disease through education, advocacy, and research. Probably nobody knows the public environment better than Paul does, all the ramifications of public health and the environment and Capitol Hill. Paul, thank you.
Thanks for those kind words, Senator. I'm not sure who that guy you introduced is. We are very pleased to be here and learn more about these topics from experts in the field and have this conversation. The Lung Association has long been active on promoting health-based ambient air quality standards. We have worked very hard over the last 4 decades on implementing the Clean Air Act, particularly on the mobile source side. I was involved in Tier 1, Tier 2, Tier 3, and congratulations to the EPA staff in the room who just completed the work on Tier 3 a little less than a month ago today, and also working on diesel issues. I think that today's program provides an opportunity for important discussion and understanding, and I hope that we will come out of today having answers to some questions, but probably more importantly, identifying the questions that still need to be answered. So I look forward to today's program. Have a great day.
Great. Thank you very much, Paul. I've known Lynn Goldman for 15 or 20 years, I think, since she was Assistant Administrator of EPA for Toxic Substances in the 1990s. She is now Dean of the School of Public Health and Health Services and Professor of Environmental and Occupational Health at George Washington University, where she presides and will preside over a massive new building, which is going up on Thomas Circle, isn't that right?
Washington Circle.
Well, and with a huge endowment, and we can understand why it is that she doesn't mess with the government anymore with all those wonderful resources. Anyway, congratulations on your good work at pulling all of that together. Thanks, Lynn. Thanks for coming.
Good morning to you all, and welcome on behalf of the Institute of Medicine. I'm Vice Chair of the Roundtable for Environmental Health Sciences, Research, and Medicine, and as you know, we are hosting this meeting this morning. I need to start by thanking the sponsors for having put together what is going to be a very fascinating day, and one talking about an issue that's extremely important in terms of public health, not only in the United States, but also globally. I think that it's crept up on us a little bit that with the expansion of more affluent lifestyles globally, inevitably what we see is more vehicle miles driven, more energy consumption, and how we're doing that is through, of course, burning fuels in automobiles, burning coal, which all then inevitably does generate these so-called fine particles, these particles that are so fine that they are in fact of nano size. They're extremely small and are absorbed through our lungs, but have impacts that are well beyond pulmonary impacts. The research that Dr. Birnbaum's institute supported and came out about now 20 years ago that began to raise some very powerful negative signals about very low levels of these particles actually had to do with cardiovascular disease and people dying prematurely from heart attacks, those who were vulnerable and because of being elderly or because of having cardiovascular disease. But we're now learning about effects on the very young, effects on infants, effects on the fetus, and I think that we're going to hear today about some of those hazards as well. So I'm very much looking forward to the information that is going to be handed us today and the discussions that we'll have. And I'm also eager to hear about those policy discussions that are to follow this. I think that this is so important and, you know, as a cause of global burden of disease and must be addressed. Thank you.
Thank you, Lynn. Lynn and I have talked for a number of years about getting this gathering together, and we really appreciate your help in doing so. When I first came to Washington now, almost 45 years ago, I was told that if you wanted to know about Social Security, all you needed was Robert Ball's telephone number. Anybody coming to Washington today, if the question were asked, how do you find out about the Clean Air Act, you'd say, well, you want Boyden Gray's telephone number. Boyden knows more about the history and involvement, I think, and engagement and intent of the Clean Air Act than anybody that I have known. He is, as you all know, served as counsel to Vice President Bush, then as counsel to President George H.W. Bush. He was one of the key people in the passage of the Clean Air Amendments in 1990, was appointed U.S. Ambassador to the European Union, U.S. Special Envoy for Eurasian Energy. We still are looking for the work that you produced on as U.S. Special Envoy for Eurasian Energy, Boyden. We need to solve the Eurasian energy issues. And he is a founding partner of Boyden Gray and Associates after many years of working at Wilmer, Cutler, and Pickering. Boyden has been one of the driving forces behind the Energy Future Coalition and has been the real framer of many of the ways in which we were trying to think through the aromatics issue as it became more and more apparent. So Boyden, thank you again for your wonderful leadership.
Thank you for that introduction. My father would say I was in very high clover. I'm just a lawyer. I got all these scientists here. It's great. All of you out in the audience. It is true that I was special envoy to the European Union for Eurasian energy. My job was to get the Southern Corridor built. That's bringing the gas in through Turkey from the Caspian. It is true that I failed miserably, but so have my successors, so I don't feel so badly. On my last night in Brussels, when I was packing up to leave, I was invited by the commanding general of the European Defense Force to have dinner. And I said, I'm packing up, I'm leaving. He sent me a guest list to entice me. And the guest list identified me as C. Boyden Gray, U.S. Special Convoy. So maybe that has something, maybe I was using fuel rather than saving it. I just want to make a very simple point to make it clear what we're talking about today. And you heard from the two scientists here that we're looking at these ultrafine particles, really, really small nano-sized particles that really get inside the lung. And what do we know about them? I think, Dr. Birnbaum, you mentioned that 10 years ago we started, and we do have an understanding about 2.5 itself and about the horrific harm that it causes. And so I just want to lay sort of a baseline for a second about what we know about the the large small particles, and understand that this conference is really about the small particles, not the large small particles. And EPA itself has said in the PM implementation rule that aromatic compounds such as toluene, xylene, and trimethylbenzene are considered to be the most significant anthropogenic secondary organic aerosol precursors and have been estimated to be responsible for 50 to 70% of total SOA in some airsheds. Same rule, EPA says, current scientific and technical information clearly shows that carbonaceous material is a significant fraction of total PM 2.5, that certain VOC emissions are precursors to the formation of organic aerosol, and that a considerable fraction of the total carbonaceous material is likely from local as opposed to regional sources, local meaning cars and trucks and buses. EPA recognizes aromatics cause PM 2.5. The issue of secondary organic aerosol formation from aromatic precursors such as toluene is an important one to which EPA and others are paying significant attention. EPA did a study more recently in 5 Midwestern cities and said about that, on average, the aromatic SOA concentration measured by aromatic tracer compounds made up 17% of the total SOA concentration in these cities. Thus, this work suggests that we are finding ambient PM levels on an annual basis of a certain level associated with present toluene levels in the ambient air. In the new MOVES model, EPA said the fuel itself may have properties that exacerbate PM formation, which may be affected by concentrations of sulfur, lead, aromatics, and impurities. With the lower levels of lead and sulfur in fuels, sulfur having even now been further reduced, the first two are presumably less of a factor in the Kansas City program than aromatics. And I'll stop there. Well, one more reference, I guess, two more references. One to the Harvard Center for Risk Analysis, which estimated that exposure to PM 2.5 originating from hydrocarbons, aromatic hydrocarbons, in gasoline causes approximately 3,800 premature mortalities and $28 billion in health costs annually. The number, depending on population, could be as high as 4,700 premature mortalities and $35 billion in health costs. A recent MIT study estimates 53,000 PM 2.5 related premature deaths from road transportation annually. Cutting gasoline aromatics by half would result in a benefit of, according to these numbers, of about $14 billion. This is greater than the PM benefits of the recent car rules, CAFE rules, and as well as the recent Tier 3 just finished rule. And eliminating all aromatics would put it in the same ballpark as the so-called utility MAC rule. So that's all I wanted to point out was what we know as a baseline from EPA's own findings. And what we hope to learn today is, all right, that's for the larger small particles. What happens? What is happening? And what do we know about the smallest of the small particles? Thanks.
Thank you, Boyden. One of the more interesting discussions I've ever been in on this subject was in Cass Sunstein's office very soon after the Obama administration took office. And Boyden had known Cass and said, let's go in and talk to him about aromatics. And we came in, and Boyden went through a very elegant discussion about the cost effectiveness of taking real action on aromatics, how much more cost effective that would be for the public health, for the ozone issues that were then part of the discussion, then trying to further squeeze down on stationary standards. It was a fascinating discussion, and it was the only time, I think, that I've ever seen a Cass Sunstein where somebody else had more to say and knew more about the issue than Cass Sunstein did. So that was impressive. But so we're on to the first panel. What, John, do you want to? Where do we go from here? You all know John Jimison is the Reed Detchen's right hand at the Energy Future Coalition with us at the UN Foundation. John has been a primary force driving all of this.
And that's made Reed wish many times that he was left-handed. I have the pleasure of introducing Dr. Alan Robinson, who will be the moderator of the initial panel. Dr. Robinson is at Carnegie Mellon and has been there as a postdoctoral fellow in the Combustion Research Facility after 2 years as a postdoctoral fellow at the Combustion Research Facility at Sandia National Labs. Is Dr. Robinson here? Okay, great. Please come up. I had the pleasure of meeting you earlier this morning, so I'm glad you're here. There have been some folks who were planning to be here whose planes did not fly this morning, as can happen when you try to get someplace on the same-day basis. And Dr. Robinson will introduce the rest of his panelists. I want to make just a couple of notes. We do have a slide clicker we will pass so that people can advance their own slides, and I assume they are showing on this monitor here. And I also want to note that this is a public workshop, and we know that there are journalists, bloggers, and representatives of the media in attendance, and we want to have as open and unconstrained a dialogue as possible. And so that will involve some of the presenters and other participants presenting work that may not be published yet or may be the work of someone else, and we don't want to have them quoted in public media or results quoted in public media that they haven't had a chance to confirm can be published. So we would simply ask that if any of our presenters request that the information they present is not for publication or citation in a public manner, that we would hope all who are present would honor that request. And with that, let me turn over to Dr. Robinson. Thanks for coming.
All right, thanks everybody for your interest in this important topic. So I guess, John, would you like just people to come up one and one, or do you want everybody to? So why don't we bring everybody up, and then maybe I'll introduce folks sort of as we go forward with the presentation. So if the first set of panelists could come up, that would be great. I think we've got enough chairs. And so essentially the format's going to be people will speak for about 12 minutes, sort of give a little bit of a background. We'll do a couple minutes of questions sort of about their specific presentation. We'll go through all 5 panelists, and that should leave us a half an hour to 40 minutes to have a little more open discussion and sort of broader questions. So let's see. Once we get everybody situated up here. So it's really my honor to introduce Dan Costa. He'll be the first person to speak, and he's the National Program Director for the Air, Climate, and Energy Research Program at the Environmental Protection Agency. His background is in toxicology, and he got a Doctor of Science from the Harvard School of Public Health. And I'm not sure much else needs to be said about Dan. He's sort of very well known in this field.
Well, thank you, Alan, and good morning to everyone. And just echoing what everyone else has said so far, this is an important meeting. The issue of PM and the implications to health and economy are substantial. OMB estimates from as recently as 2010 has shown that the PM standards alone have an impact that exceeds every other regulation in the federal government. Transportation, FDA, or what have you. So this is not an insignificant issue, and the science is evolving all the time. What I intend to do today is, I'm just sort of a small town or a small country physiologist from North Carolina. My research is in cardiopulmonary mechanisms and neurophysiology. I'm not going to talk about that. My role as National Program Director covers all of the research within the Office of Research and Development, and our collaborations with our other partners within the agency and with NIEHS and other federal agencies as well. But I'm going to try to touch on a couple things that kind of set the stage, I think, for our discussions today, and we'll go from there. So the foundation of the regulatory program at EPA is well-founded in the sciences. Just to lay the groundwork again, since this is a general audience, obviously combustion of all sorts results in particles. Particles crossing a wide range of sizes. There are primary particles, and when you throw sunlight in the midst of this with the gases and other emissions associated with PM, you generate secondary organic aerosols and other sulfate aerosols, et cetera, that are all part of a complex interaction in the atmosphere. So particulate matter is itself complex. It is a mixed pollutant, even though there is a single standard for it based on mass. People often argue, especially toxicologists, mass doesn't drive toxicity. It must be something about the particle, composition, what have you. But let's just look very quickly at the complexity of this issue. First of all, particle sizes cover a range. Those that result directly from high temperature combustion, sort of in the ultrafine nano range. Nucleation, secondary organic aerosols are in that range, but they agglomerate with themselves, but primarily with particles somewhat larger in the so-called accumulation mode. So particles are constantly moving into a larger size range, and they stabilize around 0.7, 0.8 micrometers in size. Road wear and other sea salt and that sort of thing generate coarse particles that are in a larger size range, and they were covered and still remain covered under the so-called PM10 rule. PM 2.5 came into its existence in 1997 with the PM 2.5 standard based on the health data that has already been mentioned. And in fact, when we moved from that point where there was clear suggestion that there was an impact of PM on health, the issue of composition came up. And composition varies by size, varies by region of the country. In the western part of the US, nitrates and organic aerosols are an important part. On the eastern side of the US, it's sulfate particles, and to some extent organic aerosols as well. We throw in the co-pollutant gases, and we have a very complex mix of materials. But today we're going to be talking about particles in this so-called size, this ultrafine nano range. So first of all, just to lay the groundwork again, there are direct emissions like diesel particles. Bituminous fly ash, for example, are in the nano and ultrafine range, but most of the particles in this range are from secondary organic aerosols, which is a very dynamic chemical environment. We're not, for the most part, talking about manufactured nanoparticles. That's a little bit of a different beast, not to say that future fuels, and in fact, some nano materials have been put in fuels, make it burn better, but they're not really manufactured in the sense of combustion-related particles themselves. So some things that we know about PM. PM plus the gases, the co-pollutants, adversely impact health. Acute and chronic effects have been demonstrated clearly in robust data sets. Susceptible groups, certain groups seem to be more susceptible than others. There are respiratory, cardiac, cancer-related outcomes, physiologic birth outcomes as well, and you'll hear a little bit about that today. The mechanisms, there have been a host of mechanisms reported, all of which have reasonable evidence, the biologic plausibility of what we see. Composition seems to be a factor, size seems to be a factor, and clearly, as I mentioned, host factors. Different groups respond differently and have different sensitivities. Some PM sources may be worse than others. Combustion products from fuels, fossil fuels, coal, natural gas, biofuels, et cetera, show some differences in toxicity by their emission profiles. Stationary sources, moving vehicles, also generate different kinds of particles which appear to have different potencies, if you will. Air pollution is variable, as I mentioned, in composition and comprises a very complex dynamic chemistry. But we think we know a lot, but how much do we really know? Well, one of the issues that is sort of there are many questions, but the question that focuses on this meeting is, are we missing something, the ultrafine PM? Regulating by mass ignores the constituent toxicities and unique physical attributes of ultrafine particles. Ultrafine particles contribute little to the mass, and we have a mass standard, but some ultrafines can possess high surface reactivity, and does that contribute to toxicity? Lung deposition. You can look at it from a mass-based distribution, a particle number distribution. It's not as clear as you think, but clearly with ultrafine particles, you have more particles getting to the deep lung than with larger particles. Accumulation mode of PM comprises mostly ultrafine particle agglomerates. So the ultrafine issue is actually crossing over at different size ranges. Combustion and atmospheric chemistry constantly generate ultrafine particles. So we're losing them, we're gaining them at all times. So we're stuck with the issue here. We don't, as Dr. Birnbaum mentioned, we don't have a network for measuring ultrafines. Most of it's empirically done in different studies. So we have uncertain exposure issues here, and it makes it very difficult to come up with any kind of a straight evaluation. So the question is our ultrafine particles deserving of status in the PM-NACS process? And I think most people here probably are aware of that whole process that occurs every 5+ years. It's a very arduous, tedious, and highly peer-reviewed process of reviewing all of the data associated with a particular pollutant. In this case, it would be PM. You know, what is the role of incidental ultrafine PM in the total PM story? Do we have enough weight of evidence for a causal determination, which is now really a major focus of this NACS process? I'm not going to go through this, but there are a series of documents. This one document that you see in blue up here is the integrated science assessment. It used to be the criteria document, which amasses all of the data in a integrated form that feeds into an exposure analysis on the policy side, a policy analysis, and ultimately the proposal of a rule. So the integrated science assessment, its focus on causality issues, it looks at relevant pollutant exposures. It has a systematic way of looking through the database to look ultimately at the health outcomes associated with exposure. So for the purposes of this discussion, the ultrafine particles in the recent 2012 document I just summarized here, they look at the data from cardiovascular effects from ultrafine particles, and a lot of this is epidemiologic as well as toxicologic, and the data are suggestive. The same with respiratory effects, mortality. The evidence is inadequate to infer causality at the present time. This is on the short-term end. On the long-term end, the evidence is inadequate to infer any kind of causality at this particular time, at least in 2012. So there are fundamental uncertainties that are paraphrased in the ISA. Controlled human and tox studies expand the base of knowledge for respiratory and cardiovascular effects from short-term exposures, but the evidence is still limited. We may learn more today. A lot of it seems to be diesel-based at the present time. The concentrated ambient particle systems, which is an empirical way of concentrating ambient particles, are limited, and there may be some changes in the ultrafine particles when that's actually done. Limited epi studies, again, inadequate to infer a causal relationship. The short-term exposure and mortality base is inadequate. Most studies are European, which is a slightly different mix because of the kinds of engines they have near road in that environment. And long-term exposures and outcomes are uncertain. How are we on time? Okay. And lastly, as was mentioned, there's no nationwide network for ultrafine particles. There are ultrafine particles being measured in a number of places, mostly associated with, like, for example, Southern California. They have their own network for obvious reasons with their vehicular traffic, but empirically, lots of folks, including ourselves, have been doing a lot of near-road studies to look at the issue of ultrafine particles, but there's no systematic network, realizing that these networks cost about $50,000 per site. The temporal and spatial inhomogeneity undermines the exposure estimates. So time and space are very important in ultrafine particles, just like with coarse particles. And the measurement methods are very different between the US and Europe. Europe sort of, I don't want to say boils them down, but heats them up, so you're just measuring individual particles, where if you're looking at organic particles, that may be a problem. So let me just tell you very quickly a little bit about what's going on in the EPA, and I can't cover everything, obviously. We have an intramural program and an extramural program, including our clean air centers. We have studies that range from epidemiology, animal and human toxicology studies, human controlled exposure studies, molecular studies to look at this whole scenario of mechanism and outcomes. We have emission source characterization in one laboratory, and we have another laboratory that focuses on atmospheric measurements and models. We work closely with our regional offices. We try to use the regions as sort of our empirical laboratory out in the field. And the monitoring network is an important aspect of all of the health studies, whether they're done by EPA investigators or affiliates or NIEHS. That is our primary source of exposure at this point in time. And EPA partners, other federal agencies, National Research Council, et cetera, academia, are all partners in this endeavor. So, interestingly enough, the public realizes that, we drive cars, pollution. In fact, we put it up on the board. Not only is there traffic up ahead, but there's pollution up ahead. Is this a necessary evil that we need to live with? Well, there have been great changes in vehicle emissions since 1970. Some 98%, the new diesel engines, 99% improvements. So there are great advances. Yet we still have this issue of ultrafines that comes up that we're not really sure what's going on. So the issue of near road implications is something we've been focusing on for the last 10 years or so. We have emissions characterization of vehicles themselves, involving dynamometers, et cetera. We have air quality and exposure assessments that conduct both at fixed sites, mobile sites, and we look at health effects research. So here's just a series of activities that we have in the dynamometer measurement systems, as well as collecting particles for tox studies. We have wind tunnel studies where we model dispersion from roads and vehicles moving in patterns, so we can look at, just because you're near the road, buildings can affect where the distribution of those particles go. It may not just be near road. We've been collaborating with the Federal Highway Administration in 3 different sites, Las Vegas, Detroit, and Raleigh, to do a series of studies involving health as well as measurements. And this is one major study that we have ongoing through our extramural program, a collaboration where we're doing the exposures and the health studies are being done at the University of Michigan in Detroit in an EJ community, environmental justice community of kids with asthma. And then, of course, we have the whole series of health research that's ongoing. So, in addition, we have highways, railroads, ports that we're also looking at, the issues of other fuels and potential toxicity associated with different formulations as well as exposures. And I'm just going to touch on these really quickly. Just so, some thoughts for us to discuss today, perhaps. Ultrafine particles are largely derived from studies of intratracheally instilled particles and combustion emission PM. We need inhalation studies of more ambient-like ultrafine particles if we're going to actually make a health assessment. We have to remain clear that ultrafine particles generated from combustion are not the same as nanoparticles like nanotubes, et cetera. So we need to make sure that that distinction is pretty clear. Is there a way that we can harmonize by surface area, mass, some other way across particle sizes to look at toxicity? And of course, exposures depend on sources, proximity to sources. We need greatly improved exposure estimates. We need a stronger US-centric EPI database, including exposure if we're going to make some real advances. And roadway studies need to unravel the ultrafine co-pollutant distribution, because I can assure you when ultrafine particles are up, so is NOx, so is carbon monoxide. Thank you.
Thanks, Dan. That was a great intro here. We could, if there are any really quick clarifying questions, or we'll just move on to the second speaker. It looks like we're just going to move right on. It's my pleasure to introduce our second speaker here. It's Dr. Elizabeth Galarneau, and she's a research scientist at the Air Quality Research Division at Environment Canada. And Environment Canada is sort of a blend of the EPA and NOAA. Her PhD is in chemical engineering from the University of Toronto, and she has a lot of interest and expertise in polycyclic aromatic hydrocarbons. Dr. Galarneau?
Thank you very much. It's a pleasure to be here this morning. I'm really looking forward to the discussions that will take place for this meeting. Since I'm the first speaker to talk about PAHs, I'm going to give a little bit of background information. We have two communities of scientists here at this meeting. We're starting with the physics and chemistry of the atmosphere, and later on we're going to talk about the health effects. Those tend to be studied by two different communities, but where they meet is at human exposure. As an atmospheric scientist, I work backwards from human exposure to try to understand what the sources are that are contributing to the mix in the atmosphere. So for pollutants like PAHs and many others, we start, is there a laser pointer on here? Yeah. So we start at sources. There's a variety of industrial and natural sources that emit pollutants into the atmosphere. And they can go into the polluted air mass either as primary pollutants, meaning that they're in the same form as that in which they were emitted, or they can react in the atmosphere, reactions that are exacerbated usually by the presence of sunlight, and be transformed into secondary pollutants. So regardless of whether they're primary or secondary, they mix in this polluted air mass. And it's that polluted air mass that, to which the human exposure occurs through inhalation. There are some pollutants, though, like PAHs, that are also subject to atmospheric deposition. And that's the transfer of pollutants from the atmosphere to the ground level. And when the pollutants are deposited, they can be deposited to vegetation, where they're then taken up by animals, and they can go into water bodies, and all of these combined can also be part of the food supply that humans ingest. So there's a second route of exposure for these atmospheric pollutants, not directly by inhalation, but by deposition and then ingestion. This inhalation doesn't have to occur right beside a tailpipe or a smokestack. Some pollutants, again, like PAHs, are very long-lived in the atmosphere, and they're subject to something called long-range transport, where they can travel hundreds and even thousands of kilometers in the atmosphere. And Professor Simonich is going to talk a little bit about that in her presentation. So as an atmospheric scientist, I need to look back from that complex mixture that I see in the atmosphere that humans are exposed to and try to discriminate what the sources are. But it's not a straight line. We don't know how many sources there are. Nobody has really ever gone out and completely counted and characterized every possible source of pollutants into the atmosphere. And there are a whole host of transformations that occur in the atmosphere between the source and the exposure. And we need to understand that before we can try to devise control scenarios where we control sources. So for PAHs themselves, I'm trying to be cognizant of the non-scientific audience members, so I'm just giving a little bit of background. PAH stands for polycyclic aromatic hydrocarbon. The hydrocarbon means that the compounds only have carbon and hydrogen in them. They're arranged in aromatic rings, so a single ring is a benzene ring, and you put a bunch of them together, multiple cycles or rings, you get polycyclic aromatic hydrocarbons. And there are a whole host of possible combinations, the numbers of rings and the configurations you can put them into, but most people talk about the EPA priority PAHs. There are 16 PAH species. They have between 2 and 6 rings, and these are the ones that are usually the focus of many scientific studies. Where do they come from? Well, in an urban context, they come almost predominantly from combustion sources. You can burn coal, wood, natural gas, gasoline, diesel, biofuel. Any type of fuel like that that you burn, you're going to produce PAHs that are going to be emitted. And if you look at a national inventory, the national or continental level, you'll find that actually the greatest sources are industrial or energy production smokestacks. But that is not necessarily the greatest source of exposure to human beings that are at the ground level. In urban areas, you might have mobile sources that are much smaller in total magnitude, but because the emissions are so close to where humans are being exposed, those sources might actually be more important. This is actually quite a significant research gap. We don't know yet what that vehicle contribution is in urban areas at ground level when we're trying to determine what is causing PAH exposure in human beings. One way to try to look at this is to use air quality models. And this is a map of benzoate-pyrene concentrations over North America. This is a model that we developed in my group at Environment Canada, and in a few weeks it will be coming out in atmospheric chemistry and physics. And it shows the variation in benzoate-pyrene concentrations. These are annual average concentrations for the year 2002, which was our model study year. And you can see that it roughly follows the population distribution, where you would expect the population density and industrial activity to be most concentrated, is where you see the greatest concentration of PAHs. Now that we've been able to demonstrate sort of proof of concept of this regional model, which is the only one in existence right now for North America, we're able to, as a next step, go to a finer level and look within urban areas and look at the variations within urban areas and try to tease out what the source contributions are there. There are some complications, though. PAHs have a few characteristics that make them quite complicated to study in the atmosphere. The first is that they're semi-volatile, so they're not present only attached to particles, and a lot of this workshop is about particles and particularly ultrafines, but there's also a gas phase component to these compounds as well. In general, the lighter, smaller PAHs that have fewer rings, the 2-ring compounds, are almost exclusively in the gas phase. And then the heaviest compounds, the ones with the most rings, tend to favor being in the particle phase. But this can switch around depending on the atmospheric temperature. As the temperature goes up, you're going to get more of these compounds in the gas phase. The particle size distribution is a further complication on that particle phase because particles aren't all of one size, as we just saw in Dr. Costa's presentation. You have a wide range of particle sizes. And PAHs, although they are present in all the particle size spectrum, all the sizes of particles that are available in the spectrum, they do tend to be concentrated in smaller particles. And as our measurement technologies are allowing us to measure smaller and smaller particles, we're seeing that trend continuing. They tend to be concentrated in the smallest particles, especially near combustion sources. So when I showed a map of benzoate-pyrene being modeled over North America, I said that the model was performing well, but that was total benzoate-pyrene, so it's gas plus particle phase, and it's all the particle sizes added up together, and it was averaged over an entire year. So a model may do well then, but these models, not only ours, but all the ones that have been published, don't do very well in capturing day-to-day variations. They don't do well in determining the split between gas and particle, and the particle size distribution predicted by these models hasn't even been assessed yet. So we have a lot of process improvements that we still need to make in these models if we want to look in detail at the factors that need to be explained when we're looking at human exposure, because particle size is such an important determinant of that human exposure. We're doing some laboratory studies in my group to look at this particle size distribution question. It's been known for many, many years. Almost 50 years ago, DeMaio and Korn in Pittsburgh published these data, the data shown in this top graph. These are 4 different PAHs. They were divided at the time into 2 size fractions called respirable and non-respirable, basically fine and coarse. The lightest PAH on the left, pyrene, you can see was divided in its mass roughly equally between the 2 particle size classes. And as you get heavier and heavier to the 5-ring benzoate-pyrene that's shown on the right, that heaviest compound is found almost exclusively in the smallest particles. Zoom forward almost 50 years, and you see some measurements that were taken in Hong Kong by a postdoctoral fellow that's been working with me, and you see the same pattern. Even though our measurement methods are now much more sophisticated, the light PAH phenanthrene in this case has distributions across the particle size spectrum. That's the particle diameter that's on the x-axis here. That's roughly equal across that spectrum. But if you look at the heavier PAH benzoate-pyrene on the right, you see that the peak at near the 10 micron range doesn't exist. Those heavier, larger PAHs tend to be associated with smaller particles. So this has been a consistent finding, and we don't know why. If all PAHs are emitted from combustion processes, presumably in some sort of combination of gas and particle associated with the same particle mass, why is it that when you mix them in the atmosphere, dilute them, cool them, why do you get this discrimination of large PAHs going towards the smaller particles, or staying, closer to the smaller particles than the light PAHs do? So we've been doing some lab studies, and we have actually got some results that are quite promising. These are being written up right now, and I won't go into too much detail about them, but the phenomena that we've been able to observe are consistent with what has been observed in ambient air, and we're hoping to incorporate this in our air quality model so that we can start to get a better idea of what the particle size distribution is anywhere in North America if we want to pull that out of the model simulation. So we focus on models a lot because they're so useful for determining sources. You can have a model, if it's working, you can turn a source off and determine what its contribution is by difference. So if you wanted to know what the contribution is of coal-fired power plants, you could just turn that source off in the model, rerun it, and then subtract the output from the two models, and you find out what the contribution was from that missing source. But another way that people have tried to look at PAH sources is through receptor modeling. And the mathematics of it are a bit complicated, but you can make an analogy to the mixing of paints that we all did even as children in our earliest artistic endeavors. So I've copied here just the color table that comes from PowerPoint that shows that you can fabricate any color that you want by combining 3 components in different intensities, red, green, and blue. So you can think of PAH sources as the same sort of thing. Each individual source is a combination of different PAHs that exist in different proportions. So if you had, hypothetically, 3 emission sources being combined into a mixture of ambient air, equal amounts of the yellow and cyan, and then a tiny bit of magenta added in, you would get this pale green color, which represents the mixture in the air. But as an atmospheric scientist, I'm not starting with the sources. I'm starting with the mixture of ambient air and trying to tease out what those sources were that contributed. And this is problematic because just like with colors, that pale green could have come from 2 sources, not 3, and just slightly different hues of blue and yellow. So it's very difficult conceptually, and it turns out in practice, to determine what the sources are. And this is because there are 2 assumptions behind this approach that are actually not valid. The first is that the ambient air represents a mixture of distinguishable source contributions. Each source looks different from the other. They're unique. This is not true, and I'll show that a little bit later. The second is that the relative amounts are conserved. So once the PAHs are emitted in a certain mixture, and they can be in the atmosphere for 24, 48 hours before they're inhaled, the assumption is that they don't change in relative proportion, but that is not true either. So in terms of the first assumption, that the sources are unique, there often is the use of a tool called a diagnostic ratio, where just one PAH concentration divided by the other is used as an indicator of a particular source. So it's just the same with the colors, as if the ratio of the red to the blue were somehow distinctly marking each source. In this case, we're showing molecular weight 202 PAHs, fluoranthene and pyrene, from a whole host of different sources that have been published in the literature. And what you can see is that you cannot discriminate by using these diagnostic ratios between these sources. Not only do the averages look the same, the variability for many of them is very, very large. And unfortunately, a lot of studies that use this diagnostic approach will go and pluck one number out of the literature and say that that represents their source. Say they find one number for coal combustion and they say that's it. But there are hundreds and hundreds of published studies. And so we really need to be cognizant of this. You can do a similar analysis to look at the conservation assumption as well. PAHs are not conservative in the environment, and they degrade at different rates. So the relative proportions of them changes in the atmosphere. How much time do I have? Okay, so I'm just heading into the questions then. So that's pretty much it for the research that I've done. And I just wanted to sort of reframe that in terms of the questions that have been asked of us as panelists. For the first 2 questions, we were asked, what creates PAHs? What sources create them? And the answer is that all combustion sources create PAHs. And the relative amounts depend on many factors, and they can change markedly within any given source type. There have been vehicle emission tests that have used the same engine with the same fuel and just put it through different stages of a driving cycle, and they get different proportions of PAHs. Looking back to emissions from the mix of PAHs in ambient air is almost never going to lead to the correct source identification. And we were asked if high molecular weight PAHs can be used as markers for source contributions, and I would argue that no, they can't. Furthermore, they're often degraded in the presence of ozone and other oxidants. We might have more success by bringing other co-pollutants in, non-PAH compounds, that may be markers for different sources. For the third question, I don't have enough familiarity with the situation in the United States. In Canada, though, emissions and ambient concentrations showed strong decreases after major industrial sources like aluminum plants were regulated. Those have now steadied in more recent years. And the links to traffic and other sources need to be confirmed. By logic, we think that vehicles are a source of PAHs to people walking on a sidewalk in an urban area, but in terms of quantifying that contribution, it hasn't been done yet. So we want to improve our models, use those models to identify sources and determine the effect of potential reductions, and also to clarify the understanding of partitioning and particle size distributions so that human exposure assessments can know how much PAH is in the gas phase, how much is in the particle phase, and what size particles those PAHs are associated with. And with that, I'll end. Thank you very much.
Great. No quick clarifying questions? Looks like we're okay there. So let me just introduce our next speaker. It's Dr. Stacy Simonich. She's a professor in the Department of Environmental and Molecular Toxicology in the Department of Chemistry at Oregon State University. Her PhD is in chemistry from Indiana University, and she has expertise in PAHs and long-range transport of PAHs.
Good morning. I have to say it's definitely an honor to be here and to be here with my distinguished panelists. And I want to start by asking the question, what do we know about PAHs in the human environment? And use some examples from my laboratory at Oregon State University to answer some of these questions, specifically the Beijing Olympics, which I can use as a case study for a megacity and the effect of vehicle emissions on that city, trans-Pacific atmospheric transport of PAHs, which gets into the long-range transport question, and then the studies we've been doing on photochemistry. And I should say that I'm very grateful to both NIEHS and NSF for funding my laboratory's research. So when I came to Oregon State University 13 years ago and I started to think about what research I wanted to do, I immediately thought about the unique location that it has on the US West Coast and thought about what my expertise was in studying the global long-range transport of semi-volatile organic compounds such as PAHs. And I started to think about the opportunity to study both the regional transport of PAHs and other semi-volatile organic compounds in the western US, but also this idea of trans-Pacific atmospheric transport, long-range transport of these compounds from Europe and Asia across the Pacific Ocean in as short as 5 to 7 days' time, which tends to be episodic in the spring and late winter of each year. So as I began to think about these studies, we started with some modeling in collaboration with Professor Xu Tao at Peking University, who conducted a PAH inventory, a global inventory, also an inventory within China, and combined that with atmospheric modeling to look at where the PAH emissions in China would be transported over time, and could start to put on these emissions, for example, pyrene, how far they would go and how much would go, and even a number for North America. And so what we've learned about the PAH emission inventories is that China is now the world's largest emitter of PAHs, followed by India and the US. Lung cancer in China is very significant, and that these PAH emissions are definitely increasing in developing countries where they've been coming down in developed countries. I would also mention that on a per capita basis, the US exceeds these other countries on PAH emissions, and we also know that on a national level in China, the major sources of PAHs are biomass combustion and coal combustion. So as my laboratory started to gear up for this, we wanted to take a broader look at PAHs, not only focusing on the US EPA PAHs, which we heard about in the other talk, but also beginning to look at these very high molecular weight PAHs, molecular weight 302, 6 rings put together, looking at nitro and oxy PAHs, which can be formed by photochemistry and are direct-acting mutagens, and then also looking at hydroxy PAHs as metabolites during the metabolization of PAHs, and even looking at chlorinated and brominated PAHs in an electronic waste recycling area near Guangzhou. So we've taken a broad look at PAHs along with other semi-volatile organic compounds and gone out into the environment in parts of Asia and in the Pacific Northwest of the US at different elevations
to look at what the PAH concentrations were and if they were being transported. So let's start here in Beijing during the summer of 2008 during the Olympics. And this was a very unique opportunity for atmospheric chemists to look at what the effect of starting to restrict traffic, odd and even license plate numbers leading up to the Beijing Olympics, and adding more restrictions during this Olympic time period, and then easing up on those restrictions after the Olympics. So my laboratory, in collaboration with Xu Tao, was able to collect air samples in Beijing before, during, and after these time periods. And went ahead then and measured the parent or non-substituted PAH concentrations along with the nitro and oxy PAH concentrations. That's the green or blue and purple. The bars are the PAH concentration. Here's time on the x-axis, the traffic control period, the non-traffic control period, and then this extra special Olympic period. And one thing you'll notice right away is that the nitro and oxy PAH concentrations are about an order of magnitude lower than the parent PAH concentrations, which is pretty routinely measured. We saw significant reductions of all of these different types of PAHs during the source control and Olympic periods due to the restrictions on traffic. We then asked the question, what if these restrictions were sustained over time? What would be the effect on human health? So we took our data from the source control periods and the non-source control periods, took those concentrations for the long list of PAHs we measured, and for each one used a relative potency factor to calculate the benzoapyrene equivalent. We heard a little bit about benzoapyrene in the previous talk, multiplied that by a unit risk value. We tried 2 different values to try and get at what the cancer risk would be in Beijing outside of the source control period and during the source control period if you sustained either of those over a person's lifetime. And so these are some of the relative potency factors we used. We used the IRIS, US EPA IRIS 2010 values. Let's see, where's benzoapyrene on here? So that is a value of 1. Anything greater than that is more toxic than benzoapyrene. And that now includes these higher molecular weight 302 PAHs, which frankly are not routinely measured because they're difficult to measure. So we conducted that risk assessment, and we were able to compare the benzoapyrene equivalent concentrations. That's the gray here, and this darker gray is actually just the 302 molecular weight PAHs, and compare them to some health standards. The China CIPA daily BAP equivalent standard was exceeded 13 of the 56 days. 100% of the days over this time period exceeded the EU standard of 1 nanogram per meter cubed for benzoapyrene equivalent. So we did see this reduction during the source control time period on the order of 30 to 40%. We then looked at that cancer risk assessment, multiplying by the unit risk values, and we saw that it went from 9.4 to 4.8 per million people using a rodent study unit risk value, and then from 741 to 377 per million people using the epidemiology study. So the estimated cancer risk was 46% lower due to the source control measures if they were sustained over time. And we, of course, know that that is not the case. So the total excess cancer risk would be underestimated by 23% if we hadn't included these very high molecular weight 302 PAHs, which aren't routinely measured. So especially in the case in developing countries, these are important to look at. Now, let's get to the question of long-range transport of PAHs. Let's start here at my laboratory's mountain site in Oregon's Cascade Range, 2,700 meters. It's a ski area, so at the top we have power, and we can literally dangle off the top of the mountain with our air samplers and catch air masses from either regional air masses or from long-range transport. And we've studied a variety of semi-volatile organic compounds at this site, including PAHs and pesticides and PCBs. And so some days we have air masses. Here's our site up here. These are air mass back trajectories, 10 days back in time from the day in which we sampled at our mountain site. In some cases, we have air masses that have very fast transport out of Europe and Asia, Eurasia. And other cases, we have samples and air masses that have primarily come out of these urban areas in the Pacific Northwest and even California. So using the chemistry, the measurements that we do, we combine that with meteorological modeling and satellite images, and we can figure out where an air mass originated from and how they're different or similar. So this is some of that early data. This is for polycyclic aromatic hydrocarbons measured at our mountain site. The gas phase PAH concentrations are the red line. The particulate phase PAHs are the black line. By looking at this, you can see that they're in fact not correlated with each other, which is a bit of a surprise, because if you were to measure them in a US city or even in Beijing, they would be highly correlated. So what that tells us is that they're not connected with each other. The sources are not connected with each other, and that has to do with their atmospheric lifetimes. The gas phase PAHs tend to react pretty quickly in the atmosphere, the particle-bound PAHs to a slower extent. And so we have this day, one example day, April 2004, where it was this day where we had very fast transport out of Europe and Asia, had some of the highest particulate phase PAH concentrations. Other regional air masses, very low particulate phase PAH concentrations. Let's look at another example. Let's go to these two sites, other two sites, a little bit lower elevation, operated simultaneously. In the summer of 2003, millions of hectares of Siberia were on fire, basically naturally caused fire, lots of smoke emissions from this area. This is a satellite image of fire starts, and then these air mass trajectories overlaid from two of our sites, the purple being our higher elevation site, the orange being the lower elevation site. And during the summer, we saw transport high concentrations of both gas phase and particle phase PAHs being transported to both sites. So it tells us that it can occur at different altitudes, elevations, and over a fairly wide spatial range. So not only combustion emissions from vehicles or from industry, but also from things like forest fires. So let's go to the question now of photochemistry, which you can't really talk about PAHs in the atmosphere without considering photochemistry. And we started to think about what transformation reactions might occur, both on a local level and on a long-range transport level. And we've taken filters from Beijing, PM 2.5 filters, collected ambient air, cut them up, and measured them before and after reaction with various photochemical oxidants. We've also taken some of the higher molecular weight PAHs and also just reacted the pure standards in the chamber with nitrogen oxides to look at which higher molecular weight nitro PAHs might be formed. We recently published this in January. It received a fair amount of press. And so we did this with our collaborators at UC Riverside and combined both photochemical reactions in the chamber, measuring how the chemistry changed, also looking at how the mutagenicity of the particulate matter and of the compounds changed over time. So this are the results of our studies we did where we took higher molecular weight 5- and 6-membered PAH rings and reacted them with nitrogen oxides, and we predicted with modeling and also with computational chemistry and also with measurements, we confirmed in the laboratory that these higher molecular weight nitro PAHs form. And so only a very few of them have actually been identified in the environment, in part because standards for these chemicals don't exist. So our next step is to synthesize these and to go out into the environment and see if they're present both in ambient air and in foods. So we continue to learn more and more about this class of chemicals that literally represents hundreds of different unique chemicals. So some of the work in my laboratory, to conclude, we've used the Beijing Olympics as a case study for a developing megacity and the effect that vehicles have on that city. We saw a significant reduction in PAH concentrations and inhalation cancer risk during the Beijing Olympics. Source control measures, of course, those haven't been sustained over time, but it was a good case study to look at what could be achieved. We found that nitro and oxy PAHs made up a significant portion of the mutagenicity of the PM 2.5. So even though they're a little bit more difficult to measure, we can't neglect these compounds, and we continue to learn more and more about both their chemistry and their toxicity. The molecular weight 302 PAHs are also not routinely measured because they're also a bit difficult to measure. Their concentrations contributed significantly to that overall inhalation cancer risk. We would have underestimated the risk if we hadn't included them. We've also seen on numerous occasions now that PAHs undergo episodic trans-Pacific atmospheric transport to the U.S. West Coast on PM 2.5. We've identified these novel higher molecular weight nitro-PAHs both from prediction and in the laboratory, and now we're going to be looking for them in the environment and in foods. And we have experiments underway to simulate the photochemical transformations of PAHs on ambient PM, including PM from Beijing. So thank you.
All right, it doesn't look like there are any clarifying questions, so let me just quickly introduce our next speaker. It's Dr.